everyone, and thank you for joining us today. I'm Dr. Rebecca Pasillas, Program Officer here at the American Psychological Foundation, and I am thrilled to be your host of this webinar. And as the premier private grant-making foundation in psychology, APF awards over $2 million annually in grants, scholarships, and awards that support psychologists and students using psychology to create a world where people are healthy, happy, and living with dignity. APF is unique in that it receives the overwhelming majority of its funding from individuals like those of you joining us today. We cannot express enough our gratitude to your investment in APF and the important research and projects we continue to fund. Today's conversation, it sits at the heart of everything APF Direct Action was created to do. Take psychological science off the shelf and bring it directly into the communities that need it most. As our first truly implementation-focused initiative, Direct Action funds innovative interventions grounded in psychological knowledge that address pressing community needs in real, tangible ways. As we proceed through this webinar, if you have any questions, please feel free to enter them in the Q&A feature. It's found at the bottom of your Zoom screen, and we will do our best to address all questions at the conclusion of the webinar. I am honored to be joined today by Dr. Kiara Álvarez, APF's inaugural Direct Action Visionary Grantee. Dr. Álvarez is a Bloomberg Associate Professor of American Health in the Department of Health, Behavior, and Society at the Johns Hopkins Bloomberg School of Public Health. She is a licensed psychologist and holds a joint appointment in the Johns Hopkins School of Medicine's Department of Psychiatry and Behavioral Sciences. Her research focuses on youth mental health equity, suicide prevention, and the well-being of Latine and immigrant youth, including family-centered approaches to integrated mental health into primary care and community settings. Her APF-funded project, Enhancing Mental Health Support for Latine Families Facing Immigration Stress, expands access to the Paloma program, which offers culturally responsive mental health care for Spanish-speaking caregivers of youth experiencing suicidal ideation and behaviors. By equipping community health workers with evidence-based tools and training, Dr. Álvarez is bridging that critical gap between psychological science and community care. We are about a year out from when Dr. Álvarez received her Direct Action Visionary Grant, and this conversation is really an opportunity to hear directly from her about what the year has meant for her work, her team, and most importantly, the families and communities she serves. So let's dive in. Hi, Dr. Álvarez.
Hi. Thank you so much for having me. This is really wonderful to be here today. Thank you.
Yes, I'm excited to have this conversation with you and to share with everyone the wonderful work that you've been doing. To give context to those joining us for the first time, can you walk us through your project, like what it is, who it serves, and what problems it's set out to solve?
Absolutely. So I'll talk about Paloma, the intervention, and then as we talk, we'll also talk about sort of extensions of Paloma, right, that became the broader program. But I'll start with the intervention, which really has been the foundation of this work. And it's a five plus session intervention that we developed, we meaning our team, a multidisciplinary team that you can see. Thanks for sharing the website. A number of them are on our website and some of them are here today in the audience. So we developed this intervention for youth suicide prevention, but it's unique in that it's actually focused on the parents. And so we work directly with parents of youth with suicidal ideation and behavior, youth ages 10 to 18, who are referred to us from pediatric primary care clinics. And the goal of the intervention has been to embed in settings where youth already go for ongoing care, in this case in pediatrics, and to really provide that support to parents to be able to then support them in activities that we know from the evidence base in psychology are essential to suicide prevention, things like safety planning, reducing access to lethal means, and then really strengthening those family protective factors like parent-child communication. But we also do this with a focus particularly on Spanish-speaking caregivers because we know that people who speak languages other than English are often getting less access to evidence-based care. There's less information out there. Providers are sometimes not sure where they can go to get information that's both accurate but also really accessible in a way that a parent can understand and apply. And we also know, for immigrant parents, that there are a number of stressors outside of the very significant stressor of having a child that's navigating mental health challenges. And we know that caregivers often get lost in that whole picture. They're really meant to facilitate a lot of things for their own child to be able to get them care, mental health care ideally, but they're not necessarily receiving the support they need to manage their own stress and to also understand how to navigate our system. So Paloma is meant to be a kind of a short-term bridge. It's not replacing mental health care, specialty mental health care, but it is providing those kind of bolstering those protective factors at the family level, and ideally helping people establish, a route to getting what they need for their families. And then the other piece I would add that's very unique with Paloma is that it's delivered by community health workers. And so we, certainly for me as a psychologist, the importance of having good, strong supervision, making sure that we're doing things that are, evidence-based and high quality, and at the same time knowing that there are lots of people in our sort of ecosystem of mental health that can actually serve in roles, right, that maybe we in some cases can't. And so community health workers are lay health providers, but they're coming from the communities that they serve. They're much closer to day-to-day life in those communities. They can relate to the experiences that parents are having, and they have their own, unique contributions and skills to bring in terms of communicating and sharing the kinds of information that we'd like parents to have. And so it is set up such that there is ongoing weekly supervision with a clinician, but the community health workers are really the lifeblood of the project. They're the ones that are communicating directly with families and working with them over the phone, actually. And then they're also working directly with the clinical team through the electronic health record.
It's a great way of navigating the system when the system is unknown or new or just confusing, just having the community health workers that are around, and your program providing that training to the community health workers and assisting those families. So I think such a great hybrid of psychological care and also community care at the same time. So I mentioned earlier that it's been approximately 1 year since you received the Direct Action Visionary Grant. Can you share where the project stands today? I mean, you mentioned a little bit, but also things that you've been able to accomplish in this past year since receiving this funding.
Absolutely. Well, the funding from the Visionary Grant was essential for two reasons. One is sustaining the intervention. We wanted to be able to continue delivering the intervention in the clinics that we had partnered with, continue collecting data for, this has really been our pilot feasibility study for the project. And we wanted to keep our team together, knowing all the barriers to getting continued funding. We have, this amazing team that's come together, including the community health workers and our parent advisory board that we've been meeting with now over 3 years, thanks to the Direct Action Visionary Grant. We've been able to continue working with them closely over the past year. So all of those things were essential to kind of maintaining the project and really being able to deliver it in usual care settings. And at the same time, what motivated us to apply for the funding and what we've been able to address this year is that we had also seen really a need to develop additional materials, education, and support for families around immigration-related stressors, both stressors that families have always faced in terms of navigating life as immigrants in the US, and new stressors from kind of the intensity of the political environment and of the environment for immigrants over the past year. And so that had been really essential work that was surfaced, through working with families directly, through what we knew from our clinical providers and our community level work, but also from what the community health workers were experiencing in the sessions, which is that they needed more specific content to work with families, more guidance on how to proceed in these conversations, and more support for families. And so the Direct Action Visionary Grant really helped us to meet that need. It helped us to identify something and then really very quickly be able to mobilize to create resources, to begin providing additional training. And over the course of the last year, we've continued to collect that information, to integrate it into kind of specific manualized intervention modules that the community health workers can use. But then the also really wonderful part about that is getting to move forward into thinking about extensions of it, because every time we do something new, we sort of learn something new that's needed. And so part of what came up then was that this could be a good addition to Paloma, but it also really could work as a standalone intervention and it would reach more families that way. And so that's really been the next stage that we're working on for that part of the intervention. And then I think just to say kind of very briefly in terms of then what that continued support of Paloma has helped us achieve in the last year is that now, as of June, we had over 100 referrals from 23 providers at 3 different practices. And so we were really able to reach a milestone in terms of referrals. We have 89% of our participants have enrolled of our referred individuals have enrolled in the program. And so there's a very high rate from that referral to actually enrolling. And so we see that it's something families need. And then out of all of those, 82% of them now completed all 5 sessions. And so we really see this retention in the program. We see how people continue with the program. Some of them go on for more than 5 sessions because we do provide that additional support around the immigration modules. And then I think for me, it's been so important that our community health workers they have learned so much in the project, and then they've also taught us so much and integrated so much of their their work and their vision into the project that they have been able to be retained in the project. And then ideally, hopefully in the next phase, we continue to be able to find leadership opportunities for them to train other community health workers.
Wow, it's just amazing to hear the high rates of retention and referrals, and but not only with the clients, right, but also with your community health workers, that they're excited about this program and want to continue with it. It's amazing what you shared. Well, again, reflecting on this past year, like, and if you could think about what have been some of the most meaningful early insights from the communities you're working with.
Yes, yeah, I was thinking about this a lot, leading up to this conversation. There's so many different levels, I think, of insights that we're constantly gaining. And one maybe meta insight almost would be, that this kind of funding, right, that's been flexible and that's allowed us to continue working. I think it's so important in part because the work gets so much better when you can not just hear that feedback, but immediately sort of do something about it, right? People are waiting to see, okay, we told you that this is needed. Now what? What's next? So I think that, we've had to do that at the level of the clinical environment, right? The pediatricians are seeing things clinically and then feeding that back to us. And so early in the project, for example, we really saw this need to extend intervention eligibility out to, unfortunately, younger kids. So we moved from a 12-year, entry point to a 10-year entry point. And we have had to really provide support and think about how to best support the parents of those younger kids that are experiencing suicidal ideation. And that's been hard on the one hand, but on the other hand, I think important because it's also bringing light to challenges that maybe weren't being addressed before. And so we're able to meet that need. But we've also developed content, for example, non-suicidal self-injury is fairly prevalent. Unfortunately, the pediatricians are seeing that a lot, but turns out that really, the transmitting kind of our psychological knowledge on that, on what it is, why it happens, how to best support youth with it. There was really a gap in just kind of easy information that was easy to access and share with families. And so we were able to provide that information. We now have it up on our website for providers in English and Spanish. And so some of that has been from the clinical side, but from the community side, then it's really been this incredible constant iteration. The community health workers bring forward information from delivering the sessions. And they tell us we really need more concrete strategies on how to support parents in these conversations. And then we can put together a handout, based on that information, or they tell us, a lot of parents are coming to us with this particular challenge. How do we best manage that? And so we're able to continually, I think, improve the intervention and the situations we're able to respond to, as well as really think about what's happening in the community that is important for us to be aware of, that it's not just about individuals, but it's about context. It's about what people are grappling with. And then I think the last part I would add that I think hopefully if, those that visit our website can really see the impact of this is that our parent advisory board has just been essential, that every point in the project where we do something and we kind of or think, oh, we're going to celebrate this win, they say, okay, but what's next? And they come up with another great idea, right? So they really did this for us at the level of when we really had felt that the intervention manual was finalized, we're out in the clinics, this is a big win, they've been working with us on this for months and months. They said, well, now that we have all this great information, how do we share this with more people, not just the ones in the intervention, but how do we get this out in the community? And so that led us to creating videos, that animated videos that are now on our website in collaboration with a great animator at Clio Studios. And that those videos came in again with a very community engaged process, with everyone commenting, on everything from the scripts to the visuals of how people look, in the videos. We learned a lot from that work, but then from there, that led us to them wanting to do more education in the schools. And so now we're doing more education sessions in the school that are another extension of the project. So I think that's been really wonderful, that it's been a lot of it has still been the same kind of foundational knowledge and information and strategies that we think people should all have access to, in terms of really sharing, what we know as providers out into the world. But it's also then this really amazing expertise from the community level about how people access information, what kinds of things are needed, and how we can best disseminate that information.
Yeah, I love that interaction of like the evidence-based tools and like how do you disseminate that? But then on top of that, the community's asking for more. So how do you disseminate to specifically to the community and tailor it to them? And I love that you worked with other folks like the you said the visual person. I'm sorry, I didn't catch Chloe.
Yeah,
No,
yeah, animator. Yeah, Clio
anime.
Studios who did
Yeah,
animation. Yep, yeah,
love
really
that.
amazing work.
So,
Good.
and people can access it on the website that was entered, right? The program paloma.com.
Yes, yeah, the videos are on the website, and we also have some videos going up on social media as well, via Instagram, where I'm on Instagram, and our one of our senior research coordinator, Kami Torres Hernandez. I want to mention her. She's on right now, but she has a master's in health education and communication, and so that collaboration as well of really thinking about how to best disseminate this information. And she has done amazing work on the website, on the social media campaign. So really, I think again speaks also to just the importance of that team-based approach, right? There's all things, that different people on the team are bringing, and bringing that all together creates a pretty amazing synergy.
Absolutely. So, I'm going to ask about anything specific, stories, or like, do you have any particular stories or memories from moments from the families or the community that has stayed with you that might bring to life the impact of this important work? We're talking about, the disseminating of this information and how everyone's receiving this intervention, but any particular story or moments that come to you that you like to share with folks?
Yeah, absolutely. I think I'll share actually a little bit from both sides, some of the hard conversations, and also really some of the really wonderful feedback we've gotten. And I think just starting with some of the hard conversations, I think, in trying to figure out where can we, as psychologists, for example, contribute at this level of helping people cope, with immigration stress, with the stressors in the environment, with really this just really intense violence that's happening, the fear that people are experiencing, right? There is a big gap there, because we're asking people to cope and to manage day-to-day life in the context of really kind of an unreasonable level of stress and fear, something that's really not necessary, and that is structurally, right. There's a level of structural violence that's happening every day, and I think that one of the challenging things has been, even in talking with families trying to identify how we can help, is really how difficult this is for people. People are really wanting resources, wanting information, and at the same time are sharing with us that, it feels like too much. It's very hard to take in all this information. It's very hard. For example, we have been able to incorporate a lot of information on planning for your family's safety and making plans for what happens if somebody in the family, for example, is detained or deported. And that's just a horrible conversation that nobody should ever have to have. And so we have to start with sort of that acknowledgement that this is not reasonable or okay. And yet somehow we also still have to find ways to help and support people in this time, and make sure that they are not alone. And one of the challenging things that we have heard too from families has been um, feeling alone, feeling that, for example, a parent shared that, they felt that during COVID that there was a lot of outreach actually by healthcare systems and by different agencies, that there was a lot of sense of we want to help you. People are outreaching in different languages. They're being very proactive about sharing information, and that they don't feel that now. And that they feel that in some cases that support has retreated, is not there anymore. And I think what's very hard about that is in some cases that's been done intentionally, not because systems are not helping, but because they have to be a little bit more careful about how they help and who they involve and who knows where they are and what they're doing. But that's also experienced by families in a particular way. So I do think that has been very hard. The need is so great that it's very easy to think, well, what do we really have to add here? And at the same time, I do really value all the participants, the family members that we work with, for really as well reminding us that we still do have to step up. We still do have to think about the idea that giving up or just deciding that something's not worth it is not the option, right? The option is figuring out what do people need and how do we, as teams of people, help in that space. So that's, I think, some of the challenging piece. But on the other end, I think one of the things that has been really wonderful within the program has been just the nuance, right, of working with all of these individual families, what the community health workers have learned. One of our community health workers recently gave a presentation, and I think the way she put it, which was so beautiful, was she said to her, every family is a chapter, and there's a book now with so many chapters that each one that we learn something from. And one of the pieces of that feedback from families that I think was really very powerful, and in some ways, was something that I wouldn't say was entirely unexpected, but it sort of went a little beyond what we even expected could happen in this intervention, is that parents talked about really learning about their own emotional regulation through the process of working with the community health workers. And that part of that was because they felt heard, they felt understood, and that helped them sort of, lower their guard down a little bit and try to think of different ways that they could manage. And so, we had one parent, I have the quote here, that said, the truth is, the girls, and that's the community health workers, refer them as the girls, but the truth is the girls were so patient with me because I couldn't recognize myself. I didn't know what to do. I just cried. And they found the right words to tell me what to do in times like these in a crisis. And that's very meaningful. And we've heard that also from parents who said that they were very angry or they were very frustrated all the time, right? All completely normal reactions to what's going on, but that they found ways to connect with their family beyond that, and that helped them as well feel supported, feel more in control, feel that they had ways to connect and talk to their children. We had another mom that said, I couldn't talk to my daughter before because I would yell at her instead of listening, but now I know a lot about how to help her. And now she comes home from school, she talks to me, and we can have a conversation. And I think that's the really powerful part about brief interventions. It's not that you think you're, going to do every last thing, that is needed in a situation, but you're just thinking, if we can just shift, things a little bit, if someone can feel heard and understood, if someone can feel that they have a positive experience talking to their child instead of a negative experience, then ideally that really compounds itself in a family and really leads to long-term change.
Wow. And also knowing that they're not, like you said, they were feeling isolated, but now, they have the support network to assist them, and hopefully minimizing that sense of loneliness also helps.
Mhm.
What
Yeah,
powerful
yeah,
quotes that you got from your participants.
yeah.
If I may, you mentioned
Of
already that
course.
the work that you were doing was already underway before you received APF direct action funding. So again, 1 year in, how has direct action transformed what you're able to do? And a second part to this question is, what would not have been possible without it?
Mm-hmm. Well, I think, it's addition, I've named some of the things that we were able to continue doing, but I think also that the direct action funding, it was so significant that it centered that essential role of community health workers, that it's centered the goal of addressing immigration stress and immigration trauma as a priority area. So it wasn't a situation where you had to kind of fit that in as a side priority. It was really central, right, to the call, itself for APF was very central about equity, about mind body, connection and about really highlighting this. And so I think that was very essential because, again, it really sent the signal, right, to our team that this was important. It sent the signal to the parents that we're working with that this was something that was being supported elsewhere. And then that allowed, for continued just focus, right? It supported time and effort to be able to expand our capacity to meet community needs in real time, to be able to develop these sessions and to, in the process of developing and really learn, we have, new learning about what this should look like and how we should structure it and what is it that we can uniquely contribute because there's a lot of great work out there. And so a lot of our goal is to bring that work together in ways that are useful, right, for community health workers, for the people that they serve, not necessarily to reinvent the wheel, but really to leverage a lot of the great resources that are out there, as well as develop new resources when needed. So I think that that time to be able to work on those pieces, to be able to fund, the dinner, and the incentives for the community partners to come together, right, so that they can really continue to be actively involved, even though they themselves are moms and working and busy and doing lots of other things. I think that that investment in community is so essential to doing strong research and strong, community practice and implementation. And then I think the other piece is that it also did spark new collaborations and new conversations because we were able to then connect with other partners that we know from community level work, but to really be able to come together and say, what are some ways that we can best use this information? Where can these sessions be useful? How can we develop tools and materials that other people can use? So all of that has been so essential, and I think that it really speaks to how you can really think it's a short time, right? It's been a year. We're always all kind of running against the clock trying to get a lot of things done, but it speaks to the idea that you can have an investment that really brings about sort of a new direction, as well as sustains existing work, which I think is so important because a lot of times in funding that's not the case, right? There's sort of a focus on what's new, but we really want to be able to build on the foundations of what's working as well.
And it sounds like expanding too, that with the
Yeah.
APF funds, the direct action funding is also expanded a new direction, as you were briefly.
Absolutely, it has. Yeah, absolutely. Yes. And as I said, the idea that I think we came to APF with was about meeting, this need within the families that we were serving, that are experiencing, because there really is this link too between the stress families are experiencing and unfortunately what kids are coming in with in terms of mental health, in terms of suicidal ideation. So that was really the focus, and it was such an important focus. And even then, we were able to then find out, oh, actually, maybe this is something that can be disseminated more broadly, right? Maybe there are ways to use this outside the program. And so I agree, it kind of really allowed, for expanding in different directions and hopefully creating tools and materials that are useful.
Amazing. So we already know that we're really in a challenging period, not only for research funding, but also immigration policy. And you mentioned this as you were answering some of the other questions. So how has that broader environment shaped your work this year? You touched on it. I'm just curious if you could expand on that a little bit more. And then what role does funding like direct action play in this current climate, where it's challenging for both research funding and within research, immigration policy?
Yeah, I think it's impacted on every level, really. I think if we stick to kind of just the funding piece, I think, we all know that there have been lots and lots of changes at the level of federal funding, both research and programmatic, as well as institutional, different institutions and how they've addressed that, the support for faculty and for researchers in different parts of the country has really varied. And I think that we really see that impact. I think not just short term in terms of, certainly for us, it's been, can we get funding in place to run a project? Of course, there's short term impact, but I think the really damaging piece is the long term impact to the research infrastructure, to our trainees that are coming up in this field that have amazing work to contribute, to our young people that are not even at the level of being trainees yet because they're just sort of, the people, I became interested in psychology in high school, right? Like these interests start early, seeing, I get outreach from high school students that are interested in, immigrant mental health, that have experiences themselves that they want to contribute. And so I really worry about that entire pipeline up through, our trainees currently. And I think that, that has been, a huge impact. But then very specifically around immigrants, I think, there's language around, grants cannot support X and Y, Z priorities. There's different things that are coming up that institutions have to attest to. So all of that is really, I think, wearing away, right, at the infrastructure and the work. And it's not good science, right? We know that, being able to integrate the best possible evidence on specific populations, on mechanisms of action for an intervention, on the particular structural concerns affecting different populations, all of that is very essential to good health equity research. We know that being able to engage community members of all, backgrounds and experiences is also essential. And I think all of that, is being impacted. And then, of course, for families, right, the level of stress, the urgency of the concerns that they have, it also, I think, can honestly be really easy to kind of discount the need for the long-term work because there's so many urgent kind of in the moment crisis needs. And it's so essential that we have people out responding to those, but we also need to be building, what's there for the future, right? We have in the area of suicide prevention, for a very long time, people with suicidal ideation and behavior were just not included in clinical trials. They were excluded. They were considered to be too risky, right, to enroll as research participants. So we had decades of work on depression trials, for example, that left us with no information about what works for people experiencing suicidal ideation and behavior. And so even though there's always been people researching in the space and interested in the space, that lack of infrastructure meant that we're really behind some other fields in terms of really having a good, strong, established evidence base. So I think all of that is so essential to keep the long term in mind as well, to be able to really get to the point that we have what families need and what youth need in order to kind of promote their long term well being. So I think from that, like circling back to kind of philanthropic funding and mission driven funding, I know that philanthropy is also under tons of pressure because so many people are then going in and applying to these grants. And I know, probably every funder that I've spoken to, right, there's this real increase in how many people are applying. But I do think that as hard as that, I imagine that must be too. I think it really shows the importance of continuing to create spaces where people get funded for this work, but also where people are seeing calls for research that are consistent with their goals, with their needs, because every grant that you write, every project that you develop, you're advancing the science, in some way, even when you don't get funded. And so I don't want to discount the importance of funding. People need funding to be able to do the work, both, for their own jobs and to be able to hire people and to be able to pay participants. We need it for all of those reasons, but we also do need the hope that there is some future for this work to be able to keep developing it. So I think it's important to do both. I think it's important to try to increase as much the sources of funding that we can. I think that funders absolutely should be partnering, right, with other, organizations like with APF. There's so much knowledge also being brought to the table about psychological science and about intervention and implementation. And so those kinds of partnerships to leverage the knowledge that's already there for the grants are really quite critical. But I think the visibility of funders continuing to say, we're investing in this work, we think this work is important. It's important from a values perspective, but it's also important from the perspective of science, of healthcare quality, of access, of all of these other kinds of priorities that we have, and that all people in our communities deserve to be at the table for those scientific advances.
Absolutely. But related to that, it also validates the researchers that are doing this important work with mental health and immigrant families and individuals. Knowing that there's funding available, it just really makes it even seem more important. It is important for this work, and
Mm-hmm.
validates researchers like, hey, what I'm doing is actually being supported and acknowledged,
Mm-hmm.
knowing that that's out
Mm-hmm.
there. So.
Yeah. Yeah,
Big.
absolutely.
Oh, so thinking about as you look toward the next phase of this work, we talked about the different paths that it has led you. What are your goals for how this project might influence broader conversations about immigrant mental health?
Yeah, yeah, great question. So absolutely, I think that one, I think that I really hope that it shows, right, the importance of combining, both kind of immigrant mental health broadly, but also knowledge base, right, from specific areas. One thing that happens sometimes, I think I've seen this happen both clinically and in research, is that, people might be working with a particular population, and then it's just sort of assumed, okay, they're going to cover everything in that area. And so, for example, there might be a Spanish speaking therapist and they're sort of Spanish speaking, patients or everybody's expected to go to this one therapist, right, to get the care that they need. Um, Whereas if you're English speaking, you have access to all the specialties, right, to people that specialize in anxiety or in depression or in OCD or in trauma. And so I think it's important. This is a little bit more of like a specific kind of thing, but the idea that, we can do immigrant mental health and suicide prevention, we can take our specialty knowledge in particular areas and really work on how to make sure that that gets to everyone in a community, not only at the level of language, but also understanding the level of structural and sociopolitical context that is impeding people's access, right? Access to good quality mental health care. So I do hope that, we continue to really view this, right, as immigrant children, for example, are 1 in 4 kids in our country, right? It's 25% of kids are either immigrants themselves or children of immigrants. They're living in immigrant families. So really more broadly, I should say children of immigrants or immigrant origin youth. So that's not a small population, right? They're all different, backgrounds, races, ethnicities. So there's a lot of variation. But as a group, you have, this huge portion of kids under 18 that are impacted in some way. And then you think of the ripple effect further out from them into their communities. And so this is everyone's concern, right? This is something that everyone should be aware of, everyone should know about, and that we do need to also really be thinking about influencing the conversation broadly in the direction that when you look at opinion polls, the vast majority of Americans agree with, which is that, we should have communities that are welcoming to people, that we should not be detaining people unnecessarily or breaking up families or any of these things. There's a lot of things going on now that are not at all popular at a broad population level, but often the narrative gets pushed in a different direction. And so I think we do have to sort of really emphasize the narrative that the vast majority of people agree with, about the importance, right, of immigration in the history of our country, the importance of it in the present day in our communities, and the importance that every child and every family gets valued in every community. So that's kind of the broad piece. For the project itself, I think we really want to emphasize broadly disseminating materials, and it does, takes time, it takes work, and so we're kind of, again, running to try to make some of that work. But we've really been updating our website, with the resources and materials we've developed, and then we're going to continue adding, ideally, then the manuals, training materials, and things for all of these sessions so that people can use them. And we really hope too to be able to then, move this work at the level of a multi-site randomized trial, as well as really continue that community level dissemination work. So this kind of both local and national focus, which I think ideally for all research, we should really be thinking about what's going on in our communities, but also how do we get this out to more people? Because I know that for me, I'm always learning, right, about something someone's doing in another part of the country that I didn't even know about. And so how do we get that, that communication to be stronger so that we can all benefit and we can all continue to build up these programs and projects?
Yeah, absolutely. The dissemination piece is so crucial because we know you already know what works. You already know
Mhm.
what's helpful, and sharing that with others, whether it's other clinicians, other providers, or even community health workers in other parts of the country, to know that there's programs like the Paloma project or program, that's something that is important for them to know that it's out there. And to follow up on your comment earlier about having Spanish speaking providers being the catch-all of everyone.
Yeah.
I don't know if I've been in that situation. I don't know if you've been in that
Uh-huh.
situation, but I like this whole idea of like also spreading the word that we also need specialty Spanish speaking
Mhm.
providers
Mhm.
because of folks that are coming in for diverse issues, concerns, and how
Mhm.
I don't think that's out there as much. I know it's changing
Mhm.
with time, but I feel like that's also just as important to let folks know there are um, evidence-based interventions, and on top of that, Spanish-speaking providers. It's okay to have them specialize in a certain area, a certain concern, certain issue, a certain EBP, instead
Mhm.
of being the catch-all, because I think that seems to be the default, unfortunately, in a lot of settings.
Yeah, absolutely. And the patients, clients, they should have choices, right? People should get to
Yes.
decide, what's a priority for them in a particular moment. Do they want to work with somebody that maybe they have to work through an interpreter, but it's going to be this particular experience or expertise or not, right? That those options should be available because I think often those decisions are getting made for individuals. We really have that challenge also with, I think sometimes people go, and this is directly, something we've seen in our care is that there can also be the direction of, oh, I'm not able to provide that. So it's just better that I don't. And that's not okay, right? And that's not ethical. And so, for example, if we have a patient that needs inpatient care, then yes, ideally, we'd have a Spanish speaking clinician or a clinician in whatever language, but we don't have that. And we certainly don't have that for every language. So then for someone to say, well, but with an interpreter, it's not going to be as good or as high quality. Well, what's the option? Do they not get any care at all? Do we say we know this person needs this level of care, but they can't receive it? And we do see that as well with families that have just not gotten the information they need because a provider has just not used an interpreter or has sort of assumed that if the parent needed it, they would ask for it. So we're often providing education to parents on, you can request time to talk with the person at the school or time to talk with the therapist that's seeing your child. You have a right to have information. That doesn't mean that you're going to know everything that's going on or that you're trying to invade your child's privacy, but that parents, are essential to making sure that things happen at home in many cases, but they're getting sort of cut out of the conversation, essentially. I mean, literally, because they're not able to speak the language. And so I think that kind of understanding that it is everyone's responsibility and that we all have to continue to have this sort of humility of understanding too when we've dropped the ball and where we maybe have not recognized a need, because it does happen, to all of us at different times. And so being able to recognize that and hold both ourselves, but also the systems we work in accountable, I think is
Absolutely.
essential.
Yeah, absolutely. It's a culture shift within the systems.
It is. It is. Yeah. Yeah.
Um, we talked about this, like the demand for funding, like the direct action visionary grants. We know that's super important. We know the demand is great. And on top of that, we know it far exceeds what's available. Um,
Mhm.
so researchers are navigating this environment for where federal funding is shrinking. Everyone knows that, but the need is increasing and it's growing. For someone, which you've been through this process, as someone who's been through the whole application process and then receiving this direct action visionary grant, what advice would you offer to those who are applying or considering to apply?
Mhm. Well, I think that definitely, and this is true for direct action, is true for any grant, is really understanding, what the funder is looking for and where there's alignment between what you're doing and what they're looking for. And so if you have something that doesn't fit, right, that's kind of question of is this a good fit for you or not? But I think that, the direct action visionary grants are really looking for that movement, right, on these principles and on thinking about direct action. So I think that there really has to be a focus on what's happening now, what's happening in the year of this grant, what is really the gain and the move that will happen through this investment. And I think I would advise everyone, either pursuing this or any community engaged work to invest time in building those relationships with communities. Ideally, before seeking funding. Sometimes that's hard and you're sort of building things as you go. But, investing in the relationships doesn't have to mean doing a project together or having funded work together. It means, going to events, showing up, getting to know people over time, because that allows you then to really have work that is reflecting, community needs, that's grounded in that community perspective, and that's really meaningfully engaging and working with community members. So I think that question of really what you're investing in, in a way, I think it's really about what you're investing in outside of seeking funding, right? Again, the funding is necessary to do the work. I don't want to, I'm not naive about that, obviously, in the day to day. And I think, and we also can't promote an idea that people just like, work out of passion and don't pay their bills, right? So that has to happen. The organizations need to get their funding. They need to be funded as well. Individuals need to be funded. So it's all essential, but also there has to be some arc and some purpose and some goal to what you're doing um, to keep you, kind of doing this work and to keep you motivated to keep seeking out, ways to get it to happen. And so I do think thinking about that long term, thinking about the areas where you're both passionate about it and very motivated, but also have some particular skill to bring to the table. So you might not be kind of recreating something that someone's done with a particular kind of expertise, but what expertise do you have in particular that might be able, to be brought to bear? What is your team bringing, to the table in terms of having a new approach to a problem? So those are some of the things I would think about. But I think the main, idea for me is I think in health equity work, right? I think we're in a particularly challenging time, but I think having luckily been mentored by people who had long histories in this field, many decades of work. But when I was a trainee, we also know that it's never been an easy road. It's never been a particularly straightforward, road for people to do work that is focused on health equity and health disparities. And there's ebbs and flows, in the level of support that you get for that work. So I do think that having the long view of what you're building and what you want to dedicate your time to is important because you might be developing the idea or the goal for some time before there's an opportunity, but you always can advance, your thinking about it, your precision in terms of defining what kinds of science and what kind of work you're doing. And I think that is a very important part of the process too, even as you're also being pragmatic and thinking about how to get the work done.
And the passion shows through the application
Yeah,
process that this is an
yeah,
important piece of your work, as it did
yeah,
with your application.
yeah.
So that's very important. Thank you for sharing those words of wisdom to folks who are thinking about applying or considering applying to the Direct Action Visionary grants. So I have a final question for the evening before we turn over to the audience for their questions. How would you describe what direct action in psychology looks like from where you stand?
Yeah, so I think direct action, it does really look like bringing what we know from our discipline, to bear on what the current issues are, what the current needs are. And it also involves, of course, collaboration, right, across roles and disciplines. We bring one particular sort of lens or expertise or several, and then there are many other people that bring, information that we don't have. But I think one thing as psychologists that ideally we are trained in and can really bring to bear is being able to work across systems, being able to think about how teams and groups of people work together and how to leverage those strengths. And so I do think that, the notion of it's not just action, right? It's direct action. So there's an intention there and how that is really kind of bringing things directly to the community, bringing things directly to the people that are being served, and really having that immediate impact. Sometimes, certainly, in academia, but I think in psychology as a profession, we are somewhat trained to be very like hesitant. The way that we write is always, this may result in this. We don't want to say too much. We don't want to take credit for something that might not be completely accurate, which is, good as a practice of, again, humility and again, like really thinking about what we can, what we do or don't have evidence for. But I think it can sometimes get in the way of really being able to move forward, right? Which is something that I learned sometimes from my colleagues, that come from other disciplines or roles where they sort of see a problem and they sort of jump in and immediately try to work on it. And so we can bring that together, and that's also personality and different styles, but we can bring that together. We can do work that's really high quality, evidence based, that's bringing to bear what we think is most important to bring in, from the research side, but also really use that to make change in the moment. So I think all of that is so essential. And I just think psychology as a profession, I'm in public health, I'm in prevention science, I'm across a few disciplines, but psychology as a profession for me has always been the foundation, right, of all the work I do. And I think that, it has so much to offer and so much diversity also in experiences and roles. It's really what drew me to psychology is people do all kinds of things, all sorts of different things that you might not imagine under the same umbrella and often in the same career. People have sort of multiple phases of different things they do. And I think that's a very powerful sort of flexibility and perspective. And I think that is very powerful to bring to bear in this work.
Absolutely, it does. And I do want to give you an opportunity to shout out any of your team members that may be present, just so that they know that their work is just
Yeah,
as
yeah.
important.
Yeah, absolutely. Well, I think I do just want to mention so my, the work in the Paloma program overall. I have a co-principal investigator, Dr. Sarah Polk, who is a pediatrician, and that psychology pediatrics collaboration for, in a pediatrics behavioral health project has been incredible. I mentioned our wonderful senior research coordinator, Kami Torres Hernandez, is in the audience, as well as Ellen Molino, who's our research manager, and our wonderful community health workers, Yessi and Josefa. And also on the Instagram, be able to see a video actually of Yessi that's coming up soon, talking about her work as a CHW. So I'll put that in the chat, or at least yeah.
Thank you. Yes, they are just as important, right? To help, work together as a team, overcome challenges and support each other during those times.
Yes,
And share
yeah, yeah.
the successes too.
Yeah, exactly, exactly. Yes, I think I think there's nothing, it takes work to get a full team functioning and working together, but there's really nothing like it. I think once you're able to work together and really establish that work and where you're going and where you have, shared goals and shared mission. I agree. It really keeps me grounded personally and keeps me motivated.
That's great. Well, thank you for sharing about your work and its impact with us. Let's turn now to some of the questions from our attendees. Feel free to submit any questions using the Q&A button at the bottom of your screen. And let's see here. Okay, here is a question. I'll read it out loud. How can funding bodies like APF better support the long-term sustainability of projects after the grant period ends?
Yeah, that's a great question. I'll answer from the grantee perspective. I don't know if that's more of a question for the organization too, but I think from the grantee perspective, I do think, yeah, long-term sustainability is a real challenge, and I know it's a real challenge for all the nonprofits I work with. I think that ideally, really thinking about that ability to kind of extend funding or apply for new funding, ways that grantees might be able to continue getting supported, or in cases where that's not possible due to resources, I think foundations can also support introducing, grantees to new funders. So I think having thoughts about that, about how the like kind of both the organization and the larger ecosystem can work together. I think in some large organizations, like in PCORI, for example, I know that they have some funding that's available only to current grantees to then implement or disseminate their work. So I think that type of funding is also really helpful when there's some sort of ability to then continue into a sustainability or dissemination phase. Of course, for all this work, we want to, be thinking about how we can sustain it outside of grant funding, but that's not necessarily always possible to determine in a short term. It might not be the next step. So I think those pieces are important for nonprofit funding. I would say general operating funds, right? I think that's what they'd want to say is, not having everything be dependent on specific projects and lots of, kind of reporting requirements, but to be able to have flexibility as well in how they support their work.
And to respond regarding on APF side for the direct action visionary grants, we have projects that are submitted and they're either sustainable or not sustainable after grant funding period ends. And that'll depend on the project. So we're looking for both types, specifically for the direct action visionary grant. So if the project is sustainable after the grant period ends, we want to know how it's sustained. And if it's not sustainable, we also want to know, well, why is that case? So, but I agree with what Dr. Alvarez said. It also depends on the funding organization. But regarding APF, that's what we're interested for the direct action visionary grants. We have several questions on the Q&A, Dr. Alvarez.
Yeah, I'm seeing that. Let's see. So yes, information about how you use the funds. Yeah, so I think all of the, different, projects I imagine are different. In our case, we use the funds to support salaries. So our community health worker salary, for example, typically just kind of small percentages of salaries to support their role in the particular project. And then we use it to support incentives for participants, incentives for our community advisory board members. So a lot of it is, somewhat dependent on what the project goals are. But in our case, the priority has really been to support the members of our team that are doing the on the ground work and supporting kind of the incentives and structures and procedures for the participants to be involved in the project. And then shifting to, yes, what policy shifts should occur to better match the psychological workforce and the people we seek to serve? Yes, such a great question. I know I'm sure we have many opinions about this. And I think that, well, one, I think we absolutely need a more diverse psychological workforce, racially and ethnically, in terms of, first generation college students, in terms of language, for sure. I mean, we just have such a gap in language needs, and we have a huge gap for Spanish, which is the most widely spoken language. So it's sort of like every other language, it's even worse. So I think that there could be a lot more ideally done in terms of policy shifts to support training and to support that workforce. We have so many undergraduates that are interested in psychology as a profession. We have these huge majors, and then we have these very kind of onerous pathways, right, to training. And certainly I'm trained, as a researcher, and I highly value the importance of that work. But there are people that really want to practice, right, as psychologists as well clinically. And it's very hard in some cases to find that pathway. We just also know that psychology programs are so hard to get into these days. Like it doesn't match the level of need. There's so many more people that could be getting that training that don't. So I think those are really essential. But I think the other piece is really around psychologists also being able to function in these roles as supervisors, for example, to community health workers. I think there's a lot of bidirectional learning there because it's not about just trying to get people to do the same things we do in the same way. It's not about like diluting the importance of evidence-based care and therapy, but it's about expanding kind of the number of roles on a team. And I think that that kind of task sharing kind of idea, it's not about necessarily task shifting therapy, although there's also really good evidence for the ways that that can work. But I think there's also a lot of room for this question of how we teach psychological principles, supervise people that are in these challenging roles in direct service, and better improve the reach, right, of our roles, including through people that represent different identities and different life experiences. And yes, sorry, should I go to the next one? Yeah,
Yeah,
sorry,
no, I
I'm
think
like kind of jumping in
no,
because
go
you're
for
reading
it.
the.
Go for it, because I think
Mm.
one of them is related to your website.
Oh, yes, yes. So, yes, in terms of materials available to other organizations, yes. So, we do have some things on our website. We have, thank you for sharing it. So, we have the website, we have some things there, which include our videos, some of our education materials, materials on NSSI. So, lots of information there to share. And then right now, our manuals are not directly available, but we intend to make them available ideally in this next year. So we're just kind of finalizing the plans for that. And ideally that would be something as well that we can share. But I think the website, would have a lot of information as well as links to others that are doing this work.
I'm going to ask you this next question, Dr. Álvarez, because it's so personal, but touching. It says from Lisa Harlow. I met Kiara as a student at a conference for quantitative training for underrepresented groups. She was a shining star then and has really achieved and contributed so much. How did she get started in her current interest area, working with suicide prevention in Latine populations? That's
Oh my gosh, Lisa, it's so good to hear from you. I wish I could see you physically, but thank you. Thank you for that question. This is amazing. I'm actually going to diverge a little bit just because I think this also relates to workforce. Lisa is downplaying her role here. She was the PI of this quantitative training for underrepresented groups that took place during the APA conferences. And I was a student who was really thinking that I'm not a math person. I'm going to sort of pass my stats requirement and call it a day. I'm going to really focus on qual work, which I've continued to do as a mixed methods researcher. But this conference was really what introduced me to the idea that, oh, no, actually, this is work that I can do. I can continue in advanced training in this work. And it was just really amazing, and also brought us to the APA conference itself. So this was, I think, a really example of a workforce kind of development program that really had such incredible impact. There were some pretty amazing people that went through that program, and it was active for a long time. So thank you, Lisa. I don't think you know how much impact that had on my trajectory because actually, because of that program, I went on to take, I learned about latent class analysis. I did a project in that area. I went on to take structural equation modeling. And so I became interested actually during that time because I was really focused on health disparities research. I was working in substance use. I was really focused on adolescent mental health and meeting clinical needs. And I learned about the disparities at that time in suicidal ideation and attempts being very high among Latina girls, very consistent with some of my clinical experiences and sort of shed light on things that I had seen as a clinician and before that as a youth worker. Um, but in terms of bridging, this piece actually about the quantitative training, what I was able to do for my dissertation, I didn't have access to collect data directly. I used a secondary data set and used structural equation modeling to explore the differential kind of impact of family and peer group influences. And so that's actually where it started. It was really about, again, kind of something that I had seen clinically that psychology and psychological science sort of brought, and social work, research, I should say, because Pasillas, who is pivotal in this area as a social worker and a social work researcher. So that all brought me to that interest. And then from there, that's really where I continued to work on interventions, meeting, just responding to kind of the need in that area. But it is, kind of a long, kind of winding road, but I think a really beautiful example too of how these sort of short-term, kind of investments as well in workforce can really have impact on long-term trajectories.
Well, we are at the hour. Thank you so much, everyone, for asking your questions and just listening to Dr. Alvarez. Dr. Alvarez, thank you so much for sharing your time with us. Your work truly demonstrates what becomes possible when psychology meets community partnership and when funding like direct action helps make these partnerships sustainable. Thank you to the audience for joining us tonight. We hope this conversation has sparked ideas for how you might direct your own action, whether that's through supporting APF direct action, applying for a direct action visionary grant, or bringing perspectives from Dr. Alvarez's work into your own practice or research. Please stay tuned for more opportunities to engage with APF direct action. If you're attending the 2026 APA convention, Dr. Alvarez will be presenting alongside our other direct action visionary grantees. Session details, including time, location, are available on APF's website at the link in the chat. We're also planning additional direct action focused webinars this fall, and we look forward to continuing this conversation. Have a great evening, everyone.